Hello, my name is Amy Lucero, and I'm a student of social work at National University, and I will be going over my PowerPoint titled Develop a Model of Collective Impact. Interdisciplinary teams work is a complex process in which different types of healthcare professionals work together and work together collaboratively to share experiences, knowledge, and skills in order to provide care and support to patient health. Defining a disciplinary team. Interdisciplinary teams is a generic term of reference of healthcare teams, which includes healthcare service workers, both professionals and non professionals, with the majority of them being from the professional groups providing support to clients. The collective impact. Interdisciplinary teams involve two or more health professionals with diverse background skills, sharing common health goals and exercising concerted physical and mental efforts in assessing, planning, or evaluating patient care. This interdisciplinary accomplishment through collaboration, open communication, and shared decision making and interdependent interaction allows for team work and patient success. Collaboration between mental health care workers and obstetric care professionals may help overcome these challenges. Collaborative care in the obstetric care setting is a multidisciplinary treatment approach consisting of obstetricians, midwives, psychiatrists, and psychologists, and social workers. The need and purpose of an interdisciplinary team. The need of interdisciplinary teams is increasing for the perinatal mental health community. They provide continuous support to the women and their children from the start of pregnancy to childbirth. It makes women's mental health better in the 3 to 4 months postpartum period, which was measured by the EPDS, the Edinburgh Postnatal Depression Scale. It also showed an increase in the number of women and children who were identified as being at risk of psychosocial problems and provided them with support, counseling from public health nurses, maternal seminars, and home visits. The purpose of the interdisciplinary team. It is the most efficient way to provide patient or client care. Various medical disciplines can contribute, and it provides a network of disciplines to be able to contribute. Various disciplines provide a network for discussion, provides disciplines meet on a regular basis in order to discuss patient or client progress. Each discipline is just as important. So, who are on this interdisciplinary team? There can be a physician, a nurse, a program manager, a social worker, home visitor, outreach specialist, a clinical supervisor, and a secretary. Physicians and nurses provide patient or clients with visits both inpatient and home visits. They order appropriate medication and equipment such as breast pumps, depression, and anxiety medications. They review any previous prescribed medications. They teach interdisciplinary members of current medical orders and or plans. They teach patients or clients and families of current medical orders and or plans and provide hands-on care for patient or clients. Home visitors. Home visitors provide teaching, psychoeducational teaching, parenting, breastfeeding support, and education related to perinatal depression and anxiety. They provide home visit prenatally and postpartum to assess For client needs, provide a home assessment, screen mothers for life skills assessment, screen mothers for PHQ-9 and GAD-7, screen infants for ASQ-3 ages and stages questionnaire and measure. Mental health is essential to a healthy perinatal period and maternal role adaptation. Mental health is defined as emotional, spiritual, and social well-being. The American College of Obstetricians and Gynecologists recommends that women should be screened for depression and anxiety at least once during the perinatal period using a standardized screening instrument. It is also important to educate women and their families about the baby blues and to seek assistance if symptoms do not resolve or if they increase in severity. Outreach specialists. The outreach specialists provide resources to outside resources for both client and family. The outreach specialist provides education and discussion to the interdisciplinary team about new community resources or changing resources in the community. The outreach specialist engages with the community to educate them about resources provided by the program in order to support mothers and infants. Social workers. Social workers discuss issues with the patient or client and family relating to finances, food, family interactions, emotional problems, such as resources and for additional care. Social workers discuss a discharge plan or a plan of care. Social workers contribute information to the interdisciplinary team and assess client needs in order to provide a client-centered plan. Program managers and clinical supervisors. They help lead the team and coordinate and lead team meetings. They assign patients, clients, or cases to social workers and home visitors. They assist with scheduling for patient visits, lead in providing new and continued education for interdisciplinary teams, and occasionally provides visits to patients and clients in order to provide clinical supervision. Program managers and clinical supervisors provide weekly clinical supervision, one-on-ones with social workers and home visitors. These are my references. Thank you.